Priapism. So priapism is your persistent erection which is lasting more than your 4 hours. It is a surgical emergency. Now there are two types of priapism. One is your ischemic priapism and second is your non-ischemic priapism. Your ischemic priapism is much more common as compared to your non-ischemic priapism. So let's discuss some important points regarding your ischemic priapism. It is more common. It occurs mainly because of a venous congestion which causes your thrombosis and eventually leading to ischemia. Now the most common cause of your ischemic priapism is due to the antipsychotic medications used. Now other causes include your intracavernosal injection, sickle cell anemia and leukemia. So while you are evaluating a patient for priapism, you need to take important histories of your sickle cell disease and leukemia. Now if you aspirate the blood and do an analysis of the blood from the penis, it is going to show these characteristics. There will be hypoxia, hypercapnia and acidosis. On the other hand, in case of a non-ischemic priapism, you are not going to find such feature. So these features are actually characteristics of finding of your ischemic priapism. And on your Doppler you would be seeing the absence of blood flow in the penis. So what is your treatment of your ischemic priapism? Your first line treatment includes your aspiration of sludge blood in your corpora cavernosa. Now if this fails, then you will go for an intracavernosal injection of phenylephrine, which is an alpha adenoreceptor agonist. Now if this still fails, then you go for a creation of shunt between the corpora cavernosum and glans penis or your corpora spongiosum. So these are your few important points that you need to remember in your ischemic priapism. Now coming down to the non-ischemic priapism, now this is usually due to the trauma to the central penile artery. Now because of this trauma, often there forms a fistulous connection between the artery and the sinusoidal space. Now due to the increased blood flow, there is a painless persistent erection. Please remember this important differentiating feature again. In case of an ischemic priapism, you will find a painful persistent erection, whereas in a non-ischemic you would find a painless persistent erection, and your treatment would include your androgen ablation therapy. If it does not resolve with this, then you would need to go for a selective arterial embolization to treat your non-ischemic priapism. So these were your few important points regarding your priapism. Please remember the important one-liners, that is your persistent erection more than 4 hours. Then ischemic priapism is much more common compared to your non-ischemic priapism, and your first line treatment in case of your ischemic priapism is the aspiration of the sludge blood in corpora cavernosa, and the blood from the penis would show your hypoxia, hypercapnia and acidosis, whereas in case of your non-ischemic priapism, this is going to have the normal gas features as that of your normal blood gas analysis. Thank you.